Hi, everyone. Hi, Dr. Woodley. How are you?
Hi, I'm doing great. I'm excited to be here.
Hi, everyone. Thank you for joining. You see some people were early, very eager. We love that. We love enthusiastic cat parents who want to learn. Um, we'll just give everyone a couple minutes to join, to tune in. This is live on YouTube. This will also be recorded, so everyone will be able to rewatch. And whoever is watching us on YouTube and is registered is also able to ask questions in the chat on the side. So the way this webinar is going to go today is Dr. Katie Woodley will be having a presentation for about 30 minutes on holistic cat care and dental health. So the focus is dental health. And then I'll pop back on and I will be taking the questions from the audience. So if you have a question for Dr. Katie as she's speaking, please ask in the chat. We also have a bunch of questions that were pre-submitted and we'll try to answer all of them. And Dr. Katie, as people are trickling in, do you want to tell us a little bit about, just very briefly, where you are, where do you practice, like what's a holistic veterinarian? How did you study? Is it the same as a regular veterinarian or a traditional veterinarian?
Yeah, so I'm Dr. Katie Woodley, super excited for all the amazing cat parents joining us. And I'm a holistic veterinarian in the northern Colorado region, so Fort Collins, Colorado. And I have my own business, The Natural Pet Doctor, where I do house consultations, I do acupuncture for dogs and cats, I do Chinese herbal medicine, and I also do a lot of nutritional plans for pet parents. I also offer a lot of education through our VIP club where we do monthly webinars, and I do telehealth consultations because unfortunately there's not enough holistic veterinarians. And I went to vet school, to the same vet schools that all veterinarians go to. It was very conventional. And I went to New Zealand for vet school, so Massey University. And when I graduated, I was very conventional minded. And I realized when my husband actually developed an autoimmune disease that there was another way to medicine. There was a holistic way, another side of doing things. And so I went down the path of becoming acupuncture certified, Chinese herbal medicine certified. So different training. So took a lot of different courses, took a 2-year graduate diploma Chinese herbal medicine course, and just finished actually a food therapy course. So did some extra training because it's just an amazing avenue of medicine that we can integrate in with conventional medicine and provide your cats with a lot of different options for treatments that maybe there weren't any more options or you were told there was nothing more you can do. And that's where holistic medicine is really powerful. And it gives a lot of people more hope and a longer, healthier life too when we actually integrate both in.
Well, that's fantastic. So for everyone just joining, this Basepaws webinar will be recorded. As Dr. Katie is about to start her 30-ish minute presentation on holistic cat care and dental health, you will be able to ask questions in the chat. And this is it. I don't want to waste any more of your time. Basepaws is super happy to have you, Dr. Katie, and I will let you share the screen and I will be back in about 30 minutes to ask questions from the audience.
Great. Thanks, Nadia. All right. So let me bring up my presentation for everyone and we will get started. All right. So welcome, everyone. This is the Holistic Cat Care and Dental Care with Basepaws. So excited to be here and present this information that's so valuable to you and your amazing kitties. So let's get going. Some of the topics that we are going to cover is briefly, what is holistic healthcare? What are some of those cat health foundations that you must know about in order to optimize your cat's health? What exactly is dental disease? How diet can affect dental health. We're going to talk about some dental supplements, also safe and non-toxic dental toys. And then, of course, we're going to go through your questions at the end. So brief history, already went through that. I'm Dr. Katie Woodley, the Natural Pet Doctor. I'm a holistic veterinarian, founder of the Natural Pet Doctor, and I'm located in Fort Collins, Colorado, but offer telehealth consultations to pet parents worldwide. And we're on a mission to make sure you, as an amazing pet parent, have the tools and knowledge to help your pets thrive naturally. So let's start with what exactly is holistic health. In order for us to treat the whole pet, we have to be looking at the emotional, physical, environmental, and nutritional components. These are the pillars to optimal health. And one of the shortcomings of a conventional perspective is that it's only treating symptoms. And many times that root problem is missed, which is why when you discontinue a drug, a lot of times those symptoms recur, they return. And the power of optimal health is when we integrate in Eastern medicine into Western medicine. And that is the true holistic approach to medicine and overall health. And we're going to cover these different factors because they play a critical part to your cat's dental health since everything is connected. So let's look at these 5 pillars is what they call them to optimal cat health. There's immune health, the environment, physical health, gut health, and emotional health. So let's start with emotional health. This is where I want you to think about your cat, their environment, and how are we meeting their emotional needs? Are they fighting? Do they have a safe space that they can go to? Is there a lot of stress in the household, whether it's coming from you, it's coming from the cats, it's coming from the children, it's coming from the job? These will all play a part in your cat's overall health. Next, we have environment. And this is really, really critical because unfortunately, we live in a toxic world. There's actually studies that have shown that our pets will come into contact with over 85,000 toxins a day. So this is where if your cat's going indoors, outdoors, what is outside? Are there pesticides being applied to the lawn? Is your neighbor spraying pesticides? What are you tracking back into the house? Also, we have to look at the cleaning products that we're using. Are we using safe, non-toxic cleaning products? Because keep in mind, our little kitties are naked most of the time. I know sometimes they wear cute little outfits, but what do? They walk on the floor that maybe we just cleaned, and then they groom themselves. So they could potentially be ingesting a lot of toxins. And then, of course, the water. Are you using tap water? Do you know what's in your water? These all will play a part to your cat's health. And then we have physical health. We can't not talk about physical health because unfortunately more and more cats are obese or overweight. And this is playing an adverse effect on your cat's overall health. So making sure that we're keeping them at a lean body weight, that we're engaging with them, that we're playing with them, that we're giving them stimulation. And as you can see, all of these pillars meld together. We can't just look at one because then we're forgetting the physical health. What is the emotional health? Are we stimulating them enough? So these all play a part together. And then we have immune health. What is going into your cat's body that could potentially be causing an issue? This is where your cat is getting vaccinations. This is where maybe you're putting on a flea and tick preventative every single month. We have to ask ourselves, how is this helping our pet? Is it helping our pet? And also, what is it doing to their immune health? And most importantly, how can we better support their immune health? And then finally, gut health. Food is the foundation for optimal health. And we have to look at, is your cat, one of the things I always hear is, oh yeah, he vomits all the time, or it's like a couple times a month. We need to look at what's showing up with our cat's gut health and is it truly optimal, and then assess the food and see, is this a species appropriate diet? So why is this all important? You're like, my cat is fine. He's doing great. He feels great. He looks great. This is why it's important. So you'll see little sweet Ella on the left-hand side where she's taking a nap and she had environmental allergens. We were able to change her diet and add in herbal medicine to help her. And she's no longer on medications that were predisposing her to diabetes. Or Taz, who's in the middle, who had heart failure. And if he was actually, I adopted him as a senior cat. And if we were able to get him sooner, put him on supplements, get him on the right food, we could have helped slow down his heart disease and give him a longer life. And then there's my 2 kitties, Stanley and Callie, who at my beginning of my career, when I was in vet school, I didn't realize there was a holistic way. Fed them the ways that most pet parents are. Also did all the things that I thought I was supposed to do, and didn't realize I could do more for supporting their overall health. Unfortunately, both of them passed away from aggressive GI lymphoma. But I want to reiterate, there's so much you can do, and I want to empower you with this presentation and give you some takeaway points that you can use right away to help your cats thrive. So let's start with what is dental disease. Remember, the mouth is connected to the rest of the body. So compromised dental health can affect your pet's overall health, longevity, quality of life, and interaction with you without them even potentially exhibiting obvious clinical signs of disease. So what that means is you may not even know if your cat has dental disease. So what are some of the more obvious symptoms of dental disease that you may notice in your cat? You may notice bad breath, or what we call halitosis. You may notice the tartar buildup, so that brown stuff that builds up on their teeth when you look in their mouth. Inflamed gums, so gingivitis, or even more severe cases of stomatitis, where the entire gingiva is inflamed and really affecting and hurting your cat. Decreased appetite, typically that's because of pain. We may notice weight loss, changes in behavior. Maybe your cat's not as social, they're hiding in the bedroom or under the bed. And then, of course, tooth loss. So let's briefly touch on the 4 grades of dental disease. The first grade is very mild. You might notice a little bit of plaque calculus built up. The gingiva, so the gum tissue, might be a little bit inflamed. This is the stage that is the most reversible. This is the stage we want to catch, treat, and then use a lot of the supplements that I'll be talking about and food to help support your pet's overall health to keep this from happening in the future. And then we go to grade 2, it's getting a little bit more severe. Grade 3, we're seeing that plaque, that calculus buildup, that's that thick stuff you cannot brush that off. And we're also noticing that you can see in that picture there that it's starting to extend down into the gums, down along that root. Grade 4, we're getting significant bone loss. This is where we can see tooth root abscesses. These are very, very painful for our cats. Our cats are also prone to things called feline resorptive lesions, where it looks like a cavity. And those are very painful for our cats. You might notice chattering of the teeth when you touch the gums, or chattering of the teeth when your cat is eating. That can clue you into something like a resorptive lesion is occurring. And so why does dental disease occur? And it comes down to what we call dysbiosis. And this is when the good bacteria is being outnumbered by the bad bacteria. And this is what drives that inflammation, that drives that inflammatory response. And one of the most robust findings is that periodontal disease is actually associated with an increased abundance of the bacterial species Porphyromonas gingivalis. Now, it's not super important, but when we see that the balance of good bacteria is off with the bad bacteria, that is when inflammation happens. That is when dental disease happens. So why does this dysbiosis actually occur? Many cats, unfortunately, are on an inappropriate diet. And the thing is that the strength of your pet's teeth and their gums will come down a lot of times to what we're feeding them. In 1980, it was interesting, a veterinary dental consultant actually presented a paper called Diet Consistency and Periodontal Disease in Exotic Carnivores, so your big cats, to a meeting of American Association of Zoo Veterinarians in Washington, D.C. And he actually highlighted a massive amount of work done by British scientist Sir Frank Collier. And he actually showed that the relocation of wild animals from their natural habitats into a captive environment brought about radical changes in their mouth. And this led down the path to a massive amount of research into oral pathology. And they found that the food, the firm consistency of the food, will actually increase the health of blood vessels in the gum tissue, which supports other dental structures. So they advise that animals need more of what we call this hassle factor when they're chewing to stimulate the gums and dental health, and that we needed to eliminate overcooked, smashed, blended, pureed foods if we wanted to actually achieve optimal dental health. And some more evidence, a study done in Australia in 2008 by Clark and Cameron between feral cats and domestic cats actually showed that dental calculus scores were significantly higher in domestic cats, meaning they had more dental disease than in feral cats that were fed a diet consisting of small mammals, birds, reptiles, and insects. So what that shows is that when our cats are being fed a more species appropriate diet versus things like kibble or canned food, that's kind of that smush consistency, we notice that there's an increased hassle factor. We're also getting the abrasion where your cat's able to get that tartar off of their teeth naturally. So what is a biologically appropriate diet? We have to go back to that cats are obligate carnivores. And so when we feed a higher protein diet, a real food diet, so what it means is being an obligate carnivore, they need meat. Now, this isn't to say you just go and buy meat and you put it down on the plate and that's a balanced diet. You're going to create health issues if we do that. But when we look at what is the feral cat's diet, what were those big exotic cats in the wild? It's predominantly a meat-based diet that's being supplemented with organ meats. They're eating bones, they're chewing on that. And why does this work so well for them? For one, abrasion. So gnawing on bones, hassle factor of chewing on the meat is going to take off that tartar, that calculus. It's like a natural toothbrush. But also when they are fed that higher protein real food diet, there's less starch that's converted into sugar that feeds the bad bacteria that upsets that oral microbiome. Remember, the bad bacteria outweigh the good. And those natural enzymes and good bacteria also reduce tartar buildup in those foods. So we need to look at what are we feeding? Are we feeding a high carbohydrate diet? So something like an ultra processed food or kibble is super high in carbohydrates. It has to be in order for kibble to be made. And then looking at gnawing on bones, raw meaty bones. And this is scary for a lot of cat parents and pet parents in general. Like, can my cat tolerate that? Can they handle that? Is it safe for that? And here's the thing. We can use bones like chicken wing tips or raw chicken necks. Raw meat doesn't cause an issue for most cats because they have a shorter GI tract than we do. They also have a lower stomach pH. It's more acidic. That breaks down the food. It breaks down the bones when we're using the appropriate size of bones and we're using raw food diets. So our cats are not prone to foodborne pathogens like we are. I would never recommend you go and chew on a raw chicken wing. For one, that'd be really gross. But two, you're most likely going to get sick. The other thing is not only is kibble higher in carbohydrates, which isn't appropriate for all obligate carnivores, they don't have a physiological requirement for carbs. Kibble's also heavily processed using high heat and pressure. And what this does is it actually creates byproducts like advanced glycation end products and heterocyclic amines, which are known pro-inflammatory and known carcinogenic byproducts. They create cancer is what that means. And so as a result, those dry kibble or other heavily processed foods can actually fuel inflammation and disease in the body. That includes the mouth and oral tissues. Remember, everything is connected. I wanted to give you a couple resources because you may be thinking, oh my gosh, this is crazy. These are great books to read that are both by veterinarians. Also, I highly recommend going to catinfo.org to look at more research, to look at more case studies, to learn more about cat health and optimizing your cat health, and also some of the diseases that are resulting from feeding inappropriate diets to our cats. If you're interested in learning how to create balanced diets, so yes, you want to do a home cooked diet for your cats, or you want to look at doing a raw diet or incorporating some real food into their diets, check out balanceit.com. It's a free resource for pet parents on balancing your dog, your cat's diets that is supervised by a veterinary nutritionist. So that's a great resource that I want you to take advantage of. So let's talk about bones again. So raw meaty chicken necks, cooked bones, what should you do? Oh my gosh, this is super probably overwhelming. However, keep in mind that our cats are very different from us physiologically. And also your raw food diets contain natural enzymes that help resist bacterial plaque. Many veterinarians and pet parents have actually seen healthier teeth and gums in pets eating raw food diets and chewing on raw meaty bones. So cats, once again, love those raw chicken necks, and you can give them to them once a week as a treat. They can be a bit messy, And also be careful if you have an autoimmune condition or you're immunosuppressed or if you have young children, because yes, we can still get salmonella from handling raw meats. Make sure you clean up afterwards. So the thing is if you can get your cat hooked on chewing on these raw meaty necks, not only are your cats easier to transition over to a raw food diet, but you'll significantly reduce the risk of dental disease, because remember, we're getting that abrasive effect on the teeth. It's like brushing, except for you're not trying to brush your cat's teeth now. It makes it a little bit easier. So those raw meaty bones provide an active chewing and gum cleaning advantage. Here's the thing. In contrast, cooked bones are more brittle and can splinter when chewed. You never want to give a cooked bone to your dog or your cat. That is where we run into major issues. And that's also why cooked bones come with the risk of damage to the tissues of the intestinal tract. We see foreign body obstructions. A lot of problems come from cooked bones, and they also give raw meaty bones a bad name. But here's the thing. Many cats are good at hiding pain. So you don't want to introduce raw meaty bones until your cat's had a thorough dental cleaning under anesthesia. We're going to talk more about that because I know there's a lot of fear about anesthesia, because your cat may have something where it's painful, like a feline resorptive lesion. They can have other sore areas. There can be an infection present that they may not be physically showing you, that will actually be aggravated or made even worse with brushing and dental care, so chewing on raw meaty bones, until those lesions, until that dental disease is taken care of. And so let's talk about dental cleanings, because there's a lot of fear around anesthesia. And I'm not going to lie to you, I don't like when I have to put my own dogs and my own cats under anesthesia. But here's the thing, let's talk about the pros. Why would I be recommending anesthesia dental cleanings versus anesthesia-free dental cleanings? And it's because when we're doing an anesthetic dental cleaning, for one, your cat has an endotracheal tube where we're able to help them breathe if needed. We're also have an IV catheter with IV fluids going in. We're monitoring their heart rate. We're monitoring blood pressure. We have an EKG going where we can assess what the heart is doing. You have people there supporting your cat. And we need that because when we're doing a full dental examination, we're probing in the gums. Think about yourself at the dentist. Would your cat allow that probing, especially if there's a sore area, if they weren't asleep? Most likely not. And that's commonly missed and not being done by most anesthesia-free cleanings. The other thing is when we're using an ultrasonic scaler to break off that calculus that we can't brush off, we go up underneath the gums. I've seen cats that have these resorptive lesions that will actually start chattering under anesthesia. That is how painful they are. But because they're under anesthesia, we can actually give them more pain medications. We can support them through that while we're removing the problem and assessing what's going on. The other pro for having a general anesthetic is that we need to take dental x-rays. That is so important. And I've seen a lot of dogs and cats where their teeth look beautiful, maybe a little bit of tartar. And we always say, like, this will be super quick. I don't see a lot of issues. Of course, we always say we may find other things because we're probing and we're doing dental x-rays. Dental x-rays can actually show issues underneath the gums that we can't see visually. So even if you're flipping that lip, like Basepaws is telling you to do this month, you may not see that resorptive lesion. You may not see that root of that tooth is actually being eaten away, and you can't feel, or your cat won't let you feel, and you can't tell that they're in pain. And that is why it's so important. So I don't want people to be afraid of anesthesia. I'm going to give you some tips and tools and ideas to help you feel more comfortable. Of course, the cons, we want to make sure your cat's healthy. That's why those 5 pillars I went through at the beginning are so important. We're here to optimize cat health, not to make your cat more sick. So some of the cons with not doing an anesthetic dental cleaning would be we can't probe. We can't take x-rays because we have to put a probe in the mouth, and there's no way that we can put that probe without a cat biting it, ruining it, causing harm to themselves and all sorts of issues. And then also most of the time they're not polishing the tooth afterwards. So once we've used an ultrasonic scaler or a hand scaler to remove that tartar, to remove that plaque, it creates microabrasions on the tooth. If you do not polish it and smooth that tooth surface, you are going to get faster buildup of food particles back on that tooth, which is going to lead to faster dental disease. So keep that in mind as you're looking at the pros and cons and weighing up what's best for you and your cat. And then, of course, we look at immune and detox support. Anesthesia can be scary. We're all, like, even veterinarians, we are very aware that this is high risk, and that's why we do all the things to make sure that we are keeping your pets safe. But the thing is when we support our cat's optimal health with appropriate nutrition, a few other supplements that we're going to talk about, supporting those 5 pillars of health, we can help your cat be strong, healthy, and happy, which means less risk under anesthesia. So this is my checklist for anesthesia safety. You need to make sure your cat is healthy prior to the dental cleaning. This is not to be done on the morning of the dental. So if they've never had blood work, this is not the time to run it. You need to run it prior. Do full blood work, making sure you're checking an SDMA to rule out kidney disease. Urinalysis is really important also, to check concentration of the urine, make sure there's not some urinary tract infection, to also assess if your cat has crystals, because we're looking for anything that can make them a higher anesthetic risk. This is all done prior to anesthesia. You can also use whole body support supplements starting 2 weeks prior. There's a company that I love is Standard Process. They have feline whole body support, feline hepatic support. If you want to learn more about those, you can always send me an email at info@thenaturalpetdoctor.com. And those are good because we're using whole foods. We're also using organ meats to support the body because our cats are obligate carnivores. So these are great to get the liver working optimally so that the body can detox afterwards. And then after the procedure, so after your cat's had medications, had the anesthetic drugs, maybe they're on antibiotics or pain medications following that procedure, depending on if they needed teeth extracted, you can use specific detox supplements for 2 weeks after anesthesia. So supplements that contain milk thistle, burdock root, dandelion root, these are really common safe detox supplements that we can use. And there's a lot of great companies out there that are pet supplement companies that you can use that make it easier and give you the right dosages based on your cat's body weight. And then, of course, toothpaste brands, right? Once we've gotten all clear, so after that dental cleaning, making sure there's no problems, that's when we can go in and start brushing the teeth using chews like raw meaty bones, those raw chicken necks. And some of the supplements we're going to mention are critical for keeping that tartar and that plaque away. So I listed a couple brands. There's a lot more brands out there, but I wanted to give you a couple options. But also keep in mind, many toothpastes have artificial ingredients and chemicals that can be toxic. So environment and immune health, what are we adding into the body? Toothpaste can be as simple, you can make your own toothpaste. It can be as simple as 1 tablespoon coconut oil mixed with 1 tablespoon baking soda. That could be it. I took it one step further because I love using essential oils in cats. Super controversial topic. However, we can use them safely. When you're using right brands, right dosages, you want more, make sure you go to our blog post at thenaturalpetdoctor.com and search for essential oils. And there's lots of free information there on brands and how to use them, especially with your cats. But I love adding in myrrh. I love adding in frankincense, and I love adding in copaiba. And I'm going to talk a little bit about those. But some tips. So you're like, okay, Dr. Katie, brushing my cat's teeth, how does that happen? And here's a disclaimer. Not every cat is going to allow you to brush their teeth. But what you can do is start slow. Get a finger toothbrush or get a small, like baby toothbrush, soft bristled, and start with one area. And you're going to only do this for maybe 5 to 15 seconds. Start with them licking the toothpaste. That's day 1. They get a treat. Reward them with the highest value treat that you have. That is it. Day 1, licking the toothpaste. Next, what you're going to do is lift the lip, touch the toothbrush to like the canine or the upper teeth. We're avoiding the bottom teeth because cats tend to be more sensitive. We're not brushing like we brush with our toothbrush. We're brushing in one way, one direction. And that's going to help them get used to it. But small amounts again. Remember, cats can decide that they're done. So we don't want them to get to that point. So couple strokes, treat, done for that day. And you'll slowly build up time. Now, if you have a cat that loves playing and they're crazy and you're like, there's no way that can happen. I understand. I've got one of those myself. There's no way I would choose his playtime in the morning after he's eaten to brush his teeth. That's his time for his Bumble toy. And there's no way I'd be able to brush his teeth. But at night, when he's laying on my lap and we're relaxing and he's sleeping, that's when you can slowly start introducing that toothbrush, start introducing that toothpaste. And so pick that time where your cat is more calm and quiet. And so I mentioned some of those essential oils. The reason why I love myrrh is that it has antimicrobial properties. It protects against gum disease, and there's numerous studies that showcase this. Also, it helps with pain. So if you've had a cat that's had extractions, this is where we can actually add that in, and it'll help manage their pain as they're healing. Frankincense is one of the most important and well-used oils in the animal world. And it's very well tolerated, very safe, very versatile. And it also magnifies the effects when you're using myrrh and when you're also using it with copaiba. So copaiba is really fascinating. It's actually a resin that comes from copaiba trees. And it's actually one of the highest anti-inflammatory oils. It actually is in comparison with those anti-inflammatory properties compared to a non-steroidal. That's how powerful it is. Can also use it alongside conventional drugs, and it's synergistic with those other two oils that I just mentioned. Some of the cat dental treats, some of the chews that you can use. I like VetraScience. They're a great company. They have Perio Plus feline bites that help with breath and help support that oral microbiome. There's also Perio Support powder that you can put into your cat's food that's actually pretty tasty. So a lot of picky cats will even eat it. And that powder actually contains natural zeolites that help prevent plaque formation and provide probiotics to reduce plaque building bacteria. Remember, it's all about the oral microbiome. And then we have these really cool silver vine twigs. So this is actually a natural plant that acts very similar to catnip, but actually more cats respond positively to silver vine than catnip. And so you can introduce this to your cat and they'll chew on it. So we're getting that abrasive action naturally, which is acting like a toothbrush, but you're not having to necessarily brush their teeth. Make sure, though, that you're buying an organic product, because once again, we don't want to be introducing more chemicals, more inflammatory products into your cat's body. And then some of my top dental supplements include these. So a lot of studies are showing that chronic oxidative stress is linked to periodontal disease. So oxidative stress is free radical damage to the body cells and tissues. And so we actually need this proper balance of free radicals and antioxidants for healthy periodontal tissues. So this is where we can use antioxidants to help support your cat's overall oral health. CoQ10 is very powerful, and a lot of cats, especially senior cats, are low in this antioxidant. So you can start supplementing that, typically about 10 milligrams per 10 pounds. And here's the cool thing, food is medicine. Organ meats and fatty fish like salmon also contain higher amounts of CoQ10. Also, Standard Process has a Biodent that contains a combination of cold pressed ground bone, minerals, adrenal gland, and other organ meats that actually support strong and healthy teeth, support the jawbone, connective tissues, and immune system function. And then, of course, fatty acid supplements. So your omega-3 fatty acids are great for joint health, right? But they're also beneficial for supporting oral health, periodontal tissues, reducing inflammation. And then there's a really interesting supplement that you may not be familiar with or have heard about that's called 1-TDC. And this is actually a blend of different fatty acids that are formulated into this unique fatty acid complex that inhibits inflammation of the gum tissue and also helps joint health too. The cool thing with this is that you can give it orally, so you can put it in the food, or you can put it transdermally. So on the gums itself, squeeze it out, apply it. So you could always do that with the toothbrush, and they're going to absorb it systemically into their gums. So all of these can be used together. They can be used separately, but they're working to reduce inflammation and minimize the progression of periodontal disease. And then, of course, toys. Toys are a great way to engage with your pet, provide that environmental stimulation, help their emotional health, And then we can use cat toys that are specific for dental health. So I just listed a couple that I went through and kind of looked at. Do they have great reviews? Do they have less chemicals in them? Do cats actually like them? Giving them a good review. So Pet Stages has a couple of those. And then, of course, your Kitty Kong. So this comes from the same company as your popular dog toy. And if you have like a really strong chewer cat, some cats are crazy. They're like little dogs. My little Moki will actually play tug of war with me. And so you can give this ball to them, this Kong ball, and you can fill it with goodies and other treats. And then you can play, toss it, wrestle with them. They can play with it. So that'll help engage, get that hassle factor, get them chewing on safe things that are going to help keep the tartar, keep that dental disease down to a minimum. So I have 5 steps I want you to take right now to summarize all of that we went through. I want you to pick a diet that works best for you, your lifestyle, your budget, and your cat. And I want you to potentially transition over the next 2 to 3 weeks to that new diet. I don't want you to transition 100% right away. So if you're feeding your cat a kibble diet, start incorporating some canned food. And you can use this side by side. Check out catinfo.org for some great tips on how to transition your cat safely. But this is where looking at our cats are obligate carnivores. How do we introduce a more species appropriate diet that leads to less inflammation in their body? 2, I want you, if you already haven't, book your cat's oral exam with your veterinarian. All vets aren't scary, I promise. So if you're following those tips and you're following those pillars and those foundations for health, we need to make sure that our cats have healthy, clean, pain-free mouths. And that's a great start. Check in with your vet, see where your cat stands. And maybe that means that they get a dental cleaning and then you start implementing the different things that we talked about. So that could be starting a toothbrush routine. So with that homemade toothpaste at least 3 times a week after that dental cleaning, you can try a new dental chew, get a new dental toy for your cats, and then maybe incorporating 1 or 2 of those dental supplements to support your optimal cat health lifelong. So maybe we're adding in those standard process supplements, or we're adding in that perio support. Those are super easy to find. And like I said, if you have questions, send us an email at info@thenaturalpetdoctor.com so that we can help you find those. And I want you to remember that we can control so much of our pet's health. Nutrition is one of the biggest areas that we can control. So I want to leave with you, what are you going to start doing today to help your cat's oral health? And of course, more information on where you can find a lot of our free resources, our blog posts, head to thenaturalpetdoctor.com. Like I said, send us an email here if you need help finding standard process supplements. But make sure you subscribe to our YouTube channel. Also, we send out new videos every single week that are free resources for you to help your cats thrive. And make sure you check out our Facebook and Instagram at The Natural Pet Doctor. So I know I'm going to share this just briefly, this last screen before I close this down and take your Q&A. I wanted to share with you that we are doing that giveaway for the Cat Holistic Wellness Guide. However, for all of you amazing cat parents here, I am offering a special 10% off with the code CATLOVERS. All right.
Hi, wow. Hi, I'm back with a lot of questions from our audience. Thank you so much, Dr. Woodley. This was fantastic. I know you could go on for another hour, and I know our audience could be asking questions for another hour. So let's kind of dive straight into it and try to help as many cat parents as possible and try to touch upon all these fantastic questions. So you started the whole presentation kind of with, it's all about the oral microbiome, ultimately, the good microbiome and the bad microbiome, right? And you have a Basepaws dental health test right there. And the reason why Basepaws is all about dental health this month, well, this whole year really, is because we are the first company ever to discover kind of the links between the feline oral microbiome and their dental health, right? So with this new test, we're able to test for 3 dental conditions: halitosis, which is bad breath, which often leads and is a sign of something else, periodontal disease, and tooth resorption, right? And oral microbiome changes, and as you discussed, right, oral microbiome is a combination and is a result of the food that the cat eats and of the environment. what has your experience been with your clients and the oral microbiome? Is the diet? Would you say that the diet is the number one thing you recommend? Diet and supplements to support the immune system? And
yeah, that's a great question. And here's the thing. So diet, I always refer to diet as the foundation for health because it controls so many things. And when we think about the immune health of your cat, 70 to 80% of the immune system is actually in the gut. And so if we're not feeding, like I mentioned, an obligate carnivore, that species appropriate diet, we are going to affect the immune health of your cat. Now, here's the thing. You could be feeding a raw food diet. You could be feeding a species appropriate diet, and your cat can still develop dental disease for some of those factors we talked about. Maybe they're not getting the abrasive action. They're, rather than like, I feed my cats Darwin's and it's minced. So they're not getting the abrasive action. I know dental disease will still build up. But the thing is that if you live in a highly toxic environment, or there's a lot of chemicals in the water that you're giving to your cats too, that may be a bigger problem than the food you're feeding. So that plays a part too. So that's why I always look at, when I'm working with pet parents, looking at those 5 pillars and assessing how does that look for your environment? How does that look for your cat's health? And what is the biggest focus that we need to work on? And that's where food is the easiest to, well, maybe, I know we're talking about cats, but one of the easier things that we can change, and then using the supplements to fill in the gaps.
And then food is something that we can change and try to transition our cats to a different diet. But I know there are a lot of questions that I want to address about, wow, how do I even start brushing my cat's teeth? Can I start brushing my adult cat's teeth? And I want to tell everyone that a week from today, on July 13th, we have a cat behaviorist, Dr. Michael Delgado, actually doing a webinar, and she's going to talk only about feline behavior and dental health. So how to recognize signs of pain in your cat and how to start brushing your cat's teeth. We know it's an important topic. So check our Eventbrite and our Facebook page. And now, Dr. Woodley, we got a bunch of questions about stomatitis specifically. Some people, some cat parents with young cats with stomatitis, other cat parents with cats that have stomatitis and asthma. Someone even mentioned that their veterinarian said that there has been a huge increase in the number of, in the rate of stomatitis. And if you have any insight into that.
Yeah, this is a big problem. I actually have quite a few patients that have stomatitis, and this is the hard part, where it can get to a point where the only treatment that can potentially, it doesn't even necessarily have 100% effectiveness, is removing all their teeth. This is where there's so much in the environment. I talked about all of the toxins, and we're finding that there's a lot of chemicals that our cats are being exposed to. What's in the food also can lead to inflammation. So it's really hard to pinpoint one exact thing. I think it's a combination of different things. What I find though, for cats with stomatitis, we need to really focus on, okay, well, what kind of food can we get them on right away that's non-inflammatory? Certain supplements that I tend to use are standard process immune support is really good to support the immune system, because the immune system is out of whack, essentially. It's an autoimmune type disease. And then the other thing I look at, so specifically for Kristen's question, he also has asthma. This is where I find there's some limitations with conventional versus a more like Eastern medicine approach, because we tend to, from a conventional perspective, look at the diseases as different. And so what we can do is, I see my cat in the background. What we can do is, with a holistic approach, we're keeping in mind everything is interconnected. And so if your cat has asthma, there's an imbalance there. That imbalance, if we don't take care of it, can lead to imbalances elsewhere in the body. And so that's where partnering with an integrative veterinarian and I use a lot of Chinese herbal medicine that's really powerful, where we can get your pet off of steroids. We can fix that problem before it leads to more inflammation in their body. So that's very, very powerful. So make sure, like, the ahvma.org is a great website for trying to find a holistic veterinarian or an integrative veterinarian to partner with your conventional vet if they don't offer that. That's what I do. It's not one or the other. It's all about partnership and using tools from both sides of medicine. So, looking at those supplements I mentioned, looking at food, looking at your environment, those are key factors for helping with stomatitis.
Great, because someone did actually ask where they could find a veterinarian like yourself. What was the website? Could you repeat that so we could put it in the chat?
Yep. So it's American Holistic Veterinary Medical Association. So ahvma.org.
Got it. Okay. I think I have it here, and I'll put it in the chat right now, multitasking right here. So everyone can find either locally or Dr. Woodley, you're available for online consultations too, correct?
Correct. Yep. So if you can find someone in your area, being in person is very helpful, but there's a lot of things that we can do. There's a lot of nutritional plans, looking at supplements, looking at the environment, how to detox your cat. There's a lot that we can do. So don't be afraid to reach out.
And then could you talk a little bit about dental disease and just overall feline health, right? We know that sure, dental disease is a problem in and of itself because it causes pain in the mouth. It can cause, the cat not wanting to eat. But how do these bad microbes and different dental conditions actually affect overall health? We hear that this can affect their kidneys, the liver, even the heart.
That's great. Everything's connected once again. And so what happens, our cats we already know they're prone to chronic kidney disease. And so if you have a lot of bad bacteria in the mouth, that can actually translocate to the kidneys. Everything's connected. It can also affect heart valves. It can affect heart disease. And so if we look at that grade 4 dental disease, or if your cat has severe stomatitis, think about that inflammation. You touch those gums, they bleed. That bacteria can go right into your cat's bloodstream, and it can seed out in the kidneys, in the heart, other areas. Bladder, we can see increased risks of bladder infections. There's lots of inflammation in the body, which kind of creates this compounding effect of more inflammation in the body that can lead to some of these other diseases.
Great question. Now, there's a bunch of questions we received before the webinar, and I just wanted to touch upon some of them to make sure that they get answered, because we promised, people submit questions and we would love to help them. We have a question from Piper. I will put it in the chat. Piper asked about diarrhea remedies if there are no parasites shown in feces. So what do you do? Your cat still has diarrhea. The tests say everything is fine.
So that's a great question. And of course, there's a lot of other diagnostics. So that would be where looking at what's been done, what tests have been done, also looking at what foods are we feeding. When did something start? Did it start when the cat got stressed? Maybe you moved house and now we're dealing with something that's like inflammatory bowel symptoms, IBS, and we need to actually support that cat's emotional status a bit more while we're working on the microbiome, using things like probiotics, using things like sometimes digestive enzymes, but also really looking at the cat food that we're feeding. Are there inflammatory ingredients? Canned food, is there carrageenan present? That's a known GI irritant. So there's a lot of little things that can make a big difference. A great supplement that I use for a lot of my cat patients that's really safe, even if your cat has something like kidney disease, would be slippery elm. So having slippery elm in your medicine cabinet is fantastic. You can add a little bit to broth. It's a mucilage, so it's soothing to the gut lining. And you can, give your cat a little bit of a break. You don't want to fast cats because they can get sick if they don't eat for too long. But that way you can add in slippery elm, help calm down the gut inflammation while you're figuring out what caused it and why it's continuing.
And you said you're a big fan of essential oils. We do know that essential oils can be dangerous. There's also not all essential oils are created equal. Let's say that. We have someone asking, how to learn more about the oils. Is there a good resource you would recommend?
Yes, this is a great question. And the thing is too, I'm going to just disclaimer, MLM companies a lot of them don't actually make bad essential oils. Their price is higher because of that MLM structure. So a lot of like your doTERRA Young Living are actually really good quality essential oils, but I know a lot of people don't necessarily want to use those types of oils because of that. But I just wanted to put that out there. There are a lot of other great companies. If you're looking at getting started with essential oils and you're terrified of them, use Animal EO. It's an essential oil company that is made by a veterinarian, Dr. Melissa Shelton. It is all she does. So Animal EO, like EO is in essential oils, and she uses them on amphibians. She uses them in her aviary. That is how safe these are. And she's actually never had an adverse reaction. And I think she's been doing this for like 20 years now. So that's a great resource to go and check out. And like I said, we have a lot of free resources on our YouTube blog and on our normal blog at thenaturalpetdoctor.com. Check those out. We also have a VIP club where we actually taught for over 3 hours on how to use them safely, natural remedies that you can use them for, how to use them to keep your cat and your dog safe.
How about this? Sama K is asking about incorporating raw bones with flat-faced kitties. Any thoughts from experience, from years of experience?
So this could be where what you could potentially do is you could get those little chicken wing tips and you could actually hold it while you introduce it to your cat and see how they gnaw on it. Because yes, the anatomy of these cats, the way that we've, bred cats and the different breeds that we have, there may be some limitations for some of the things that I recommended. So this would be where it'd be really important to getting your cat used to having their teeth brushed if you're not able to introduce those raw chicken necks. But that would be another, see how they do. It's pretty amazing. I see a lot of clients that use them. Also, if you're on Instagram, you'll see a lot of people showcasing like raw feeding with their cats. And you'll see these cats that have flat faces that are actually able to eat those. But you want to be there. You want to supervise. You want to make sure that they're not like gulping it down. They're not doing anything silly. That's very, very important.
Great. And then I know we're punning these questions one after one, but there are so many, and I'm trying to get to as many as possible. I will say we, as Basepaws, we cannot comment on any specific brand. Of course, whatever Dr. Woodley says is her personal and professional opinion. So there are some questions that I will just not be able to address because we can't really talk about particular brands of food or types of food, but you can always book a consultation with Dr. Woodley, and she'll go into more detail about different brands and supplements. But let's talk about dental disease or gum disease. You had that beautiful list of stage 1, 2, 3, 4. Is stage 2 reversible?
That's a great question. And the thing is I've actually seen it be reversible if we're able to get cats to chew and get that abrasive action. So whether that comes from a raw meaty bone, whether it comes from a chew toy, whether it comes from their chewing on the silver vine twig, and that's where that stage 2, from that picture, it hasn't really gone super deep into the gum tissue. And so what we can do is if we're getting that tartar, getting that startup of that calculus off of that tooth, that's where the bacteria is. And then if we're using some of those supplements that are supporting the good microbiome so that we're reestablishing the good bacteria versus the bad bacteria, that's going to help keep your cat's gums healthier. If you're using some of those supplements that are supporting the gingiva, supporting the bone structures, that's also going to play a part. But I wouldn't say it's not reversible. And if you're trying these things and it's getting worse, every pet is different, then definitely you need to get your cat in for a dental cleaning. You do not want to wait for them to get to stage 3, stage 4, because that's when, for one, they're under anesthesia longer because they need extractions. It takes longer. Your cat loses teeth. It's more painful. So you don't want to wait for those later stages.
And then right before we go into our giveaway, so we are giving away one of Dr. Katie's holistic cat wellness guides for cat parents, and we'll select a random winner just in a minute. But before we do that, are there 2, 3, 5, 10 products that you think every cat parent should have in their cabinet? You said slippery elm is one. Are there any others that you would recommend for everyone? And where they can be bought? Someone is asking where.
Yeah, I think the biggest things are what are good gut support, because we see so many cats that are vomiting or having GI upset. So using things like probiotics, so getting a good broad spectrum probiotic is really powerful. There's a lot of different ones out there that are great. We have a great blog post looking at the different types, whether it's spore-based or other things. So go to that blog post at thenaturalpetdoctor.com and you can check that out and some of the brands that we actually recommend. But I would say good gut support, slippery elm 100%, because that can help you get through like an emergency when it's, after hours or a holiday weekend, which is when a lot of things happen. The other thing is a lot of cats feel stressed and may not be showing it, or they're manifesting it as peeing outside the litter box, or they're attacking their brother cat, or they're getting upset or pulling out their hair. So making sure that we have something to help calm them, whether that's rescue remedy or if that's like Feel Away that you can plug into an outlet and just diffuse that. I use the essential oils, but I know a lot of people aren't super comfortable with that. So those would be two products that I would also have on hand that are great to use. In terms of like omega-3 essential fatty acids, a lot of pets are actually low in that. So even starting your pet out on something like Nordic Naturals omega-3 essential fatty acids would be a great option too. So I think those would kind of like looking at how are we supporting overall health, how are we supporting the aging process, how are we supporting gut health? Those would be big ones.
Great. And briefly, probiotics. Is there anything we should be looking out for when we look at the ingredients in a probiotic? What is important and what should not be in there?
Yeah, so I tend to use hypoallergenic, meaning that there's not a lot of added flavorings. Because if your cat already has food sensitivities or intolerances, that can actually make it worse. Also, you want to make sure that the company has been doing research, so you actually know that those live bacteria, beneficial bacteria, are actually present in that product. That's really important. If you're using something that tends to be Lactobacillus bifidobacterium, a lot of companies will have too low amounts. So what we call colony forming units, or CFUs, we need that to be above 10 billion CFUs. So that's really important. Those facts are all on that blog post because it's super confusing. But there are a lot of good companies out there. Now, if your cat is sensitive to GI upset and has issues, you may find that adding in a probiotic can actually like flare it up. So that's where partnering with an integrative veterinarian is really helpful. Or you can even start with something like a spore-based bacillus probiotic. But probiotics can get kind of intense, can be a little bit confusing, and they're not necessarily the end-all be-all for every cat. But when we use them appropriately in the right situations, they can be really powerful at helping your cat feel better.
And this is all on your website, thenaturalpetdoctor.com. I know someone was asking where these blog posts are. They're all on Dr. Woodley's website, as well as a lot of videos and access to the Facebook community, correct? The private Facebook. Is it a private group or is it a open group?
Yeah, so we actually have a private group, the Natural Pet Parent Community on Facebook, and I do live weekly Q&As there. So you can join that. And then we also have a VIP club where we do monthly webinars too. So that you can access that, take a look at that. You can register for that at our website, so thenaturalpetdoctor.com. And then our blogs, of course, are at our website.
I need to ask another question by Jessica because it's so intriguing. It has never come up before.
Oh, yeah.
And it's about giving cats mice. I suppose it's the mice you buy for reptiles or like for snakes. I never thought of people actually doing that.
Yeah, this is actually a great question, Jessica. So this is what we call prey model raw. So you'll see people like feeding, this sounds awful, but like little baby quails to their cat. I know this is getting really intense. So, but the thing is never live. So there's not like any harm to them. You don't want to, that's not appropriate. You don't want to feed the mice live. You don't want to feed like baby quails live. And you also want to know where you're sourcing it from because you can introduce the risk of parasites. So that's super important to know. And also, how are they sourcing it? How is it shipped to you? Was it frozen? Those are all factors that come into play. But the mouse is actually like, when you look at a mouse and you look at a species appropriate diet for a cat, a mouse is what we should be feeding. I'm not saying for everyone to go and get mice and start feeding them to your cat. Your cat probably won't, a lot of cats won't know what to do with it, especially if they're on kibble. But, you know, when we look at the protein content, water content, all of that, it actually makes up the most appropriate diet for a cat.
Great. Let's go to our giveaway now to have something a little bit less intense. As we promised, we are giving away, well, Dr. Woodley actually is giving away one of her amazing guides to one person who registered for the event. And if you registered for this event, you will also get a follow-up email. In that email, you'll be able to watch the replay of this webinar, and we'll also send you a discount code for Basepaws dental health test. This is a DNA test, but the dental health test looks very similar with like a purple. Yes, exactly. Great. And I will share my screen now. Just a second. Okay. I hope you can all see this. So Amanda Bujuris, congratulations if you're here. If not, we will email you. I just took a picture. You won Dr. Woodley's holistic cat wellness guide, is it?
Yes, that's it.
Perfect. Thank you everyone for joining. We covered a lot of material. We answered a lot of questions. I really appreciate all of you. Basepaws is grateful to have partners like Dr. Woodley and to have audience and customers like you. You are the best cat parents out there, and we are very privileged and lucky to be working with all of you. And for any questions, we are here. We are organizing another webinar next week. We have Instagram lives. If you have any questions about your cat's dental health, about our new product, you can ask us, and Dr. Woodley is available on her website through her contact form too, right? At naturalpetdoctor.com.
Yep. Thank you so much for having me, and thanks everyone for being here. You are why I do what I do, so thank you.
And we will see you again in about a week, everyone. Thank you.